video is for waxing, and it's actually going to be a full waxing video. It's going to include brow, lip, underarm, bikini, and full leg. So we're going to start as if we just arrived to work, and we are going to wash our hands at the sink. So we're going to wet our hands. We're going to find a coin size amount of liquid hand soap, and we're going to wash our hands together down to the wrist, and we're going to wash the back of our hands together down to the wrist. We're going to wash our fingers, and we're going to wash the backs of our fingers. We're going to wash our fingertips and our nails. We're going to wash between our fingers and our thumbs. We are going to wash our thumbs, and we're going to wash our wrists, and we're going to do all of that interlocking wash thoroughly, 20 to 30 second minimum, and then we're going to rinse everything underneath the water. Once we have done a proper rinse, we're going to get some disposable paper towels, and we're going to turn off the faucet, dry our hands completely, throw those disposable paper towels into the trash, grab our hand sanitizer, that's 70% ethyl alcohol, and we're going to sanitize our hands. And once we've sanitized our hands, we're going to prepare our work area and station for waxing. So let's talk about what happens for that, especially because we have a lot to do. So in order to get your area ready, you're going to disinfect your workstation, bed, and equipment using a disinfectant wipe, following the manufacturer's instructions. We're going to check equipment to ensure that all devices are in safe working order and plugged into a working receptacle. Super important, you need to make sure you have turned on your wax. You want to gather clean supplies needed for the facial service, storing in a clean, closed container, and you'll dispense products needed for the service. You'll prepare disposable portion cups for each product with a portion of the product by opening the top of the container and ensuring the tip of the nozzle does not come into contact with the disposable portion cup tray, or remove product with a disinfected or clean single-use spatula. We'll close the lid to the product and set the portion cup tray on the tray. We'll place disposable table paper on the disinfected bed to ensure that the wax does not fall onto the bed. And we don't have disposable table paper, so we have prepared our bed with the sheets, the fitted sheet, the flat sheet, etc. The towel horizontal along the top of the bed. All of that is fine. You just have to know that, of course, you're going to clean it and change it between each client like you always would. And what I'm going to do now actually is show you my tray before I do anything else, including client consultation, etc., etc. So we are going to review what I have on my tray, and just note that my wax is faux, it's honey. I would have like a wax station tray where my wax would be on, soft or hard wax would be on, etc., that I would have checked the plugs and everything and turned it on. So I have cotton rounds, and I have 2x2s, I have 4 squares. I have wooden Q-tips, stick Q-tips. I have all variety of sizes of wax sticks and wax strips, all different sizes, lengths, thicknesses. I have my tweezers, and I have scissors. Scissors would be for if I needed to cut any more wax strips, etc. If there's a hair I needed to trim. Obviously tweezers, we know what those are for. Gloves, because you're going to be wearing gloves for this service, no doubt, always, every time. Water, just in case. I have my pre-wax. I have my powder. I have my wax remove. And I have my post-epilation, like my soothing step. So I have everything here for the wax, and this is my wax, but remember my wax is turned on ahead of time. And I'm just going to move that out of the way. Just wanted you to see that I have prepared what I need to do for the service. I'm going to spend a little bit longer today when we talk about client consultation, because I want to talk about contraindications and etc. But I'm going to note before I start talking about all that I have washed my hands and prepared my area, but I would always be greeting my client with clean hands at the same time. I'm going to go through this quickly on this form for my client consultation form. here, but I also am going to go to my textbook and touch on some things there as well. So with this full body waxing, I just want to make sure I'm covering everything in the client consultation form at the beginning, because she's going to be having lots of waxing done today. So we're going to greet the client and escort them to the work area and assess the client's current style. We're going to determine the client's preferences and assess the client's needs. We'll assess the client's skin by performing a skin analysis to ensure that there is no inflamed, infected, broken, raised, or swollen skin in the area to be worked on, or an open wound or sore in the area to be worked on, infection or infestation, for example, lice, to prevent from safely performing the service. We'll assess client's consultation form for any medications and products used within the last 72 hours, and we'll consult on any known allergies. We'll consult with client on any facial surgeries within the last 3 months, and if the client is under a physician's care. We'll assess if the client is prone to cold sores or fever blisters. We'll assess if the client has used exfoliating or lightening agents within the last 72 hours, like alpha hydroxy acids, beta hydroxy acids, hydroquinone, etc. We'll assess facial injections within the last 3 weeks, like Botox or hyaluronic fillers. And if the client is free from those contraindications, and get my textbook here. We're going to go over more on this client consultation form. Note that there are some contraindications, such as certain moles or warts, that will become apparent only after working with the client and closely surveying the skin. These contraindications can be noted on the form or in the computer if you do it that way at a later time, but make sure not to wax over these areas to prevent causing irritation or spreading viruses or bacteria to other areas. So we're also going to be looking for, because we're working on legs today, varicose veins, unusually pronounced moles or warts, cuts, abrasions, wounds, open sores, active herpes, acne, skin diseases or disorders, sunburn, rashes, cysts, or boils. If any of these conditions are present, we do not perform the waxing service. It's important to note that herpes in particular is highly contagious, and you should never perform a waxing service on a client who has an active breakout. That includes on the mouth for your lip wax or anywhere else. If the existence of the following health conditions, health conditions may cause the client to bruise, swell, or experience excessive pain during a waxing service. In addition, conditions such as diabetes impair the healing process. So if they have diabetes, poor circulation, or if they're chemotherapy or radiation treatments, high blood pressure, low pain threshold, or lupus, make sure that that's a conversation. And then also you have to think about medications, like that was on the other thing that we talked about. So do not wax while a client is on Accutane or for about 3 months after the client ceases taking that medication. Instruct clients to avoid use of retin A and alpha hydroxy acids for at least 48 hours prior to and after the service. We did talk about AHAs and BHAs on the other form. And these things right here, final things to talk about: oral and topical medications, treatments, you want to look at their client consultation form. Accutane we just mentioned, antibiotics, cortisone creams because they can really thin out the skin. Retin A and Renova, once again, it'll be too sensitive for the wax. Alpha hydroxy, beta hydroxy, we said, and chemical peels. So that's where you have to have that serious client consultation and make sure that you're going over all of that before you even think about performing the waxing service. So we're going to talk about some more things later, but that's a little bit more in depth with waxing that needs to be noted on when you do your client consultation. If your client is free from any of those contraindications, you can move forward with the procedure. And thankfully, my client is. So let's get our client comfortable for the facial part of the waxing, and then we're going to talk through all the things that we're going to move around and change when we wax underarms and bikini and leg. But right now, we're going to do the face. So let's talk about that. I'm going to get her comfortable here and just put a little roll towel under her head. And I'm going to take the hair out of the face, and I'm going to use actually a hairnet because it's going to hold her hair back a little bit easier. Because we're starting with the brow and the lip, I want the hair out of the face. So we're going to do that. And then for now, I'm going to use another towel, and I'm going to completely cover up her chest and neck. And if she had clothing on like décolleté, she wouldn't. She would have disrobed because and put on a drape because she's having her underarms waxed, and she's also having her bikini waxed. So she probably would have had, she would have either worn a bathing suit, which we'll talk about that later, or she would have specific underwear that we can provide here for waxing. That are disposable. So just note, we've got her ready for the face, and then we're going to work our way down. Let's get our hands ready and get gloves on. So we are going to wash our hands at the sink, and we're going to get that liquid hand soap. So we wet our hands. We're going to rub our hands together down to the wrist, and we're going to wash our hands, back of our hands down to the wrist. We're going to wash our fingers, and we're going to wash the backs of our fingers. We're going to wash our fingertips and our nails. We're going to wash between our fingers and our thumbs. We are going to wash our thumbs. We are going to wash our wrists. We're going to do all of that interlocking cleanse for a minimum of 20 to 30 seconds. Then we're going to thoroughly and properly rinse them under the water. We're going to grab disposable paper towels or towels to turn the faucet off, dry everything off thoroughly, throw those paper towels in the trash, and if it was the towel, it's now dirty. It's going to go in a closed container until time for laundry. Get your hand sanitizer, 70% ethyl alcohol. You're going to sanitize your hands. And then you're going to put on gloves. So making sure that you get your hands nice and dry, you're going to put your gloves on. Okay, so I'm going to get her brows ready. Note to self, I am never going to put wax on a client ever that I don't test on myself. So I'm going to test it before I put it on her brows, but I'm just going to prepare the area. So the first thing that I have to do is remove any makeup or anything that might possibly be on that brow area. So that's what I'm going to do first. And what I'm looking to do here is I am looking to remove makeup, moisturizer, eye cream, eyeshadow, anything that could be anywhere around this brow area that we're going to wax. And I'm going like in the direction of the hair growth. I'm also going away. Between the brow as well, everywhere. A little foundation, maybe concealer, anything that could be on this area. And then I'm going to dry it, and I am going to apply powder, because we definitely want to be removing hair and not skin. And so we need to mat that thing down like you would not believe. So I'm going to be applying now powder to the skin. Okay, and I'm sure you can see that it's totally matte. And we already mapped out the brow shape and everything that she wants. So before I'm even gonna go in there with wax, I'm gonna test it on myself. So I'm gonna get a little bit of this stick here, and I am going to get some wax, and I am going to test it on my inner arm. Perfect place, and it feels good, but I'm gonna remove it, make sure it feels a-okay. And it does. So I know I'm safe to come in here to the eye area and apply some wax. So I am going to get some of this wax, since I know the temperature is good, and I'm going to come into her brow, and I'm going to go at about a 45-degree angle, and I'm going to apply it up underneath the brow here, exactly where I want to remove, and in the direction of the hair growth. That's very important to note, that I'm working in the direction of the hair growth. So when I get to this outer part, I'm going to take it down a little bit, because the hair starts to grow down. And she's a real trooper, because she's getting like everything waxed. I don't even know what to say about that, but she sure is. And then I'm going to take my wax strip, and I'm just pulling it really nice and tight. And I'm pressing, and I'm going to pull the skin tight, and I'm going to remove it in the opposite direction of the hair growth. And then I'm going to press, so that takes the sting away a little bit. Cut some of these in half. They're just like way too long. Hold the skin tight and remove it. And that's good. There's a few hairs I'm going to have to tweeze, but nothing major. I'm going to go on top of the brow. Sometimes you'll find that you don't have to, but this particular client likes a little bit of extra hair removed, so that 45-degree angle. Once again, I'm going within the direction of the hair growth. Hold the skin nice and tight. And you're always going to remove in the opposite direction of the hair growth and apply in the direction of the hair growth. I'm going to go ahead and continue to wax today. We're going to do all the waxing before we do any of the tweezing on the brow. She has a lot to get waxed, so we're just trying to be mindful of her timing. Yet also we want to do a spectacular job, of course. Pulling that skin a little tighter. Tightening the skin. right in between the brow here. Trying to hold it nice and tight. And then we're going to do a little bit of that remove now, just to get any little wax residue out of the way before we tweeze. And so I'm just going to get a cotton round on my tweezers, and I'm just going to get anything that I need to get that's left over. But really, our wax did a great job. And when I'm tweezing, I'm removing also within the direction of the hair growth. So I'm going to go ahead and soothe that area, and we're going to move on to the lip. So post-epilating here, nice little calm, soothy. And now we're going to get in there for this lip. So we are going to do a quick cleanse and then a quick powder. Same rules apply for every area, in the sense that you want to make sure you can get off all the oil, the foundation, makeup, and then we're going to dry it really good and powder it, because you never want to wax on damp skin or oily skin. Do a little powder. And I don't have to test the temperature of the wax, because same client, I just tested it for the brow. So I know that we are okay to keep moving. Obviously, if she had just been a client coming in for just this, I would have tested it for this client and this, and every time I use it on a new person, I'm always going to test it on myself first. Got two different directions growing of hair growth here. So that's the first thing I did, was look and analyze. And I can see that. And so what I did was apply the wax in both the directions of the hair growth. And now I'm going to remove it away and then press, because it's really stingy and uncomfortable here. So I analyzed that hair growth, taking that time as I am cleaning, looking at that hair growth, and I'm like, I see, okay. And then I'm going to up and press. Go to the other side now. Now I just broke that stick in half. And I don't even see the half of the stick. It's not very nice. Oh, there it is. So I'm applying in the direction of the hair growth, and then when I get to the end of the lip, I've got to go down a little bit because that's how that hair grows right there. Hold the skin nice and tight. Skin tight, pulling in the opposite direction, which means now I'm going up, and then press. And then I have one little area that left that I need to do, which is right between the lips. And this hair grows down. And I'm going to try to get it right up to the nostrils too, because that also, this little bit of hair right here is very challenging. Maybe a good idea for someone to go put their tongue underneath that. It helps sometimes. So I'm going to hold the skin tight on the sides of the mouth and just press it. And then I'm going to do a little remove here, little wax remove, so that I can tweeze anything that I might not have gotten. But I'm going to try to be timely because this is a sensitive area. Like any waxing, I want to be efficient and I want to be quick. So I've got my tweezers and I've got my cotton round, and I'm just going to get in here, and really everything looks really good. The hardest, of course, it's right up here in this inner area here. Which is not comfortable, so I'm trying to be quick about it. So let's do her soothe right there, because ouchie, that might need a nice little soothe. And we're going to move forward. So the next part of her that we are going to be waxing is going to be her underarms. So the good news is she's in her drape, and this particular mannequin, unfortunately, she does not have, let's see any more of her than this right here. So this part right here. So she doesn't have any arms here, but we would take an arm out and we would be placing it like, here, let me try to put my camera so you can see. Up behind her head, so elbow wide, hand behind her head. And I'm going to get my book now because we're going to be talking through the remainder of these wax positions, how and why. So I really want to make sure that I don't miss any details for you all, because she was already in her sheet and she had a drape on. She would be positioning her arm exactly as I told you. So she's going to be lifting her arm and placing her hand behind her head, one arm at a time, of course. And the first thing that I would be doing is I would not be sitting. I would be standing up and I would be assessing the direction of the hair growth carefully, because it's very common for the hair under the arms to grow in several different directions. If the hair grows in several different directions, you have to apply wax to each section in the direction of the hair growth, and then remove each one of those sections in the opposite direction, just like we did for the brow and the lip. You're going to be doing that for the underarm. So she's going to stay like that as you remove each individual section. Now, we would, to her underarm, do exactly the same thing. We would apply that pre-wax solution first, after we've analyzed. Then we apply the powder, because we've got to make sure everything is completely dry and there's no trace of oil or moisture, deodorant, anything like that. We've gotten all of that off. Then we are going to test the wax on ourselves if it's a different client. This is the same client. So we're going to get some wax out, just like we did. We're going to dip the spatula into the wax pot, wipe the side off until there's just a thin coat of wax on one side of the applicator. Then, holding the spatula firmly at a 45-degree angle, place the tip on the skin, let the wax run down the spatula, spread the wax as thinly as possible over the desired area, and then you're applying it in the direction of the hair growth. Obviously, you're done with that spatula at that point. Discard it. Then you're going to apply your wax remover strip, which is going to be a larger one, and you're going to have a little edge that you can pull off for a grip. You're going to smooth it over the area, pressing it firmly in the direction of the hair growth. Then hold the skin nice and taut, and you're going to remove it in the opposite direction of the hair growth. You're not going to be pulling up. You're going to try to pull close to the skin. And then you're going to apply pressure to that area immediately to help that stinging situation. Then you're going to check the underarm area and strip to make sure that the wax and hair has been successfully removed. Then you're going to repeat the procedure through the different areas of directions of hair growth that you saw, and you want to work quickly and get all of the hair off of the one side. Then you have to repeat it on the other underarm. So once you're done with this side, the client, that arm can go underneath the cover. This one comes out of the sheet, goes behind the head. You do your pre-antiseptic, your pre-wax rather, removing any moisture, any oil, any deodorant. You put your powder. You don't have to recheck your wax. You assess the growth of the hair. You're going to put the wax on in the areas specific to the hair growth. The larger strip, pressing it down, hold everything really tight. Remove it as close to the skin as you can, opposite direction of the hair growth. Work all the way around. Then you're going to use that the wax remove. So any wax residue you need to get off. And then you're going to check that area, and you're going to grab your tweezers, and you're going to tweeze any remaining hairs that might be in the underarm. And you always remove with tweezers in the direction of the hair growth. Once you've gotten all of the underarm hair off of both sides, you can apply soothing gel or medicated lotion to the entire waxed area. Then you would present the results to the client. One thing to note is that it is not uncommon for clients to bleed in the slightly from the follicle for a newer underarm wax client, because the underarm hair is often very coarse and dense. Bleeding will cease with continued waxing as the hair thins and becomes sparse. So that's one of the reasons that we wear protective gloves. And then we're going to move forward to the next part of the body that we're going to wax, and we're going to go ahead and go to the bikini area. So we're going to do a classic bikini wax on the same client. We've already obviously been over all of the contraindications. Draping for this is different. So they would have on either their bathing suit or disposable undergarments that you've given them here at the salon and spa. You're going to settle them on the facial bed, which they are. They'll be on their back. You can prepare the skin one side at a time. So one leg will be straight and the other leg will be bent out in like a butterfly position. So knee to the side, leg turned out, one leg straight, one leg turned out. And then you can tuck the sheet around the long straight leg. And then you can tuck and wrap around the waist so that you're giving as much privacy to the client as you can. When that person puts their leg like this, so it's like foot at the knee, like that, it would actually be foot at the knee, you would assess the direction of the hair growth along the bikini line, along the bathing suit, or the disposable underwear. And if it grows in several directions, you're going to apply the wax to each direction, each section where it grows in a different direction, and you're going to be applying the wax, of course, as we know, in the direction of the hair growth. So let's, and remove it in the opposite direction. So let's talk about what we do with the one side, the legs out. You're going to apply that pre-wax solution to remove any residue of body lotion. You're going to dust that area with your powder to remove any trace of moisture. We do not have to retest the wax here because it's the same client, but if it was not, this would be the time that you would test the wax on your forearm. You're going to obtain wax on a narrow spatula and then wipe the side, the back, and the tip until only a thin coat of wax remains. Then you're going to apply the wax in the direction of the hair growth along the line. And if remember, you've analyzed it, so you're going to do in sections if you need to. Maybe some is down and maybe some is in. So you're going to start with that first area. You're going to begin on the upper thigh. You're going to hold your spatula at that 45-degree angle, let the wax come down, and then you can spread it out as thinly as possible in the direction of the hair growth. You're going to discard the spatula, and then you're going to apply a removal strip, taking that narrow strip of fabric, making sure you have an edge for a grip, smooth it over the wax, pressing and rubbing it a few times. You're going to pull the skin tight, and then you're going to remove this strip quickly in the opposite direction of the hair growth, staying as close to the skin as you can instead of going up with your removal. And then you're going to apply pressure to the waxed area immediately to help reduce that momentary stinging. You will repeat the procedure on any new area. You're going to work inward toward the panty line in this manner, then wax along the panty line, drawing the knee up slightly if needed as you go along. You can ask the client to help the skin stay tight with their hand if need to. You're going to work around and along the panty line towards the back, and then you'll switch the leg positions when the entire area is clean and repeat on the other side. So they get to straighten this leg out, bending this leg foot to knee to start, and it'll work up, and you can wrap the towel in, or excuse me, the sheet in on this leg. And then after you're done with both sides, you get that wax remove and get any residue off. You can grab your tweezers, and then you will remove any hair, stray hairs, with your tweezers. Once you've done that, you'll finish with the soothing gel. And that will complete the bikini area. It takes some time. You're going to want to work quickly. Obviously, once you've got that soothing gel on, you can show the clients your results. It's the same thing with the bikini as it is with the underarm. If it's a newer person to waxing for the bikini, they might bleed slightly from the follicle because the hair is coarse and dense, but that will cease with continued waxing as the hair thins and becomes more sparse. So that's another reason why, of course, we wear our protective gloves. And now we get to finish the client's waxing with the leg. So we're going to talk about the lower leg, and we'll talk about the upper leg because they will have to flip over. And our lower leg would be from the top of the knee to the ankle. The full leg would be from top of the thigh to the ankle. And we've already done everything that we possibly could have done because she was getting this waxing, all of the things done. So of course we don't have to worry about the client consultation. We do want to drape the client. So if you're just doing from knee down, you will keep the sheet now from just right above the knees and all the way up for the client. So it's just, once again, offering those disposable undergarments if they don't wear their bathing suit. And then instructing them, she would have already removed her clothing from the waist down because she had a bikini wax. So you're going to settle them now. They'll start facing down. And those clients' upper legs and torso are completely covered with the sheet. You're going to look at the back of the leg and assess the direction of the hair growth. And if it grows in several directions, of course, we're going to apply the wax to each section in the direction of the growth and remove it in the opposite direction of the growth. We will up to those lower legs. Now on the back, we're going to apply that pre-wax solution so that we can remove any residue of a body lotion. We're going to dust the area with our powder, making sure that it's all dry and matte. And then we don't have to recheck the wax on ourselves. We're just going to get to go ahead and obtain wax and start right away, dipping the spatula into the wax pot, wiping the side, back, and tip until a thin coat of wax remains on one side. And then you're going to apply the wax below the knee, holding the spatula firmly at a 45-degree angle. Place on the tip of the skin, let the wax run down the spatula, then spread the wax as thinly as possible over the desired area. Remember to apply the wax in the direction of the hair growth. So you're going to go in sections based on hair growth. Some may be down, some may be over and in along the calf area. So you're going to work in sections. And then you're going to take a wider strip of fabric, fold an edge over so that we can use as a grip. Smooth it over the remaining portion of the wax. You're going to press and rub a few times. You're going to pull the skin tight and taut just like you did everywhere else. With one hand, and with the opposite hand, you're going to remove this strip quickly in the opposite direction of the hair growth. You're going to try not to pull the fabric straight up. Instead, you're going to pull it as close to the skin as possible. Then apply pressure to the area immediately to reduce the stinging. And then you repeat that procedure on the new area. You're going to continue waxing across the bottom of each leg. Then you'll turn the client onto the back and wax the tops of the legs. Then bend the legs slightly and wax the kneecap. And then you'll remove any excess wax with that post, that remove. And then you can use your tweezers if there's any stray hairs that you need to remove. And then you can apply the soothing gel on the entire lower leg. And then we're just going to review the top of the leg really quickly. If that's an area that your client wants, it would be just up to that top of the thigh, and you would have done the backs of the thighs while they were face down, and you would do the front of the thighs. Like you're going to do the knee with a bend, but you could start at the top, and it's exactly the same procedure. You're going to assess the direction of the hair growth. Then you're going to apply that pre-wax solution, making sure you get any bit of body lotion off, lightly dusting the powder, once again, matting it out. Then you've already observed the direction of the hair growth or the hair growth pattern. So you would then obtain your wax, scrape off any excess on the back and the sides, apply that spatula to that section in the direction of the hair growth. Once the wax comes down thinly, then you put your strip on and you're going to press it in the direction of the hair growth a couple times. You've got that little bit of the fabric left so that you can work and grab it, and then you hold the skin taut. You pull it in the opposite direction of the hair growth, staying as close to the skin as possible. When you remove, press it down for the stinging. And you're going to do all the top of the legs and the back of the legs. And then you would, of course, follow up with that wax remove, that post-epilation, and then tweeze if you need to, and then soothing gel to finish. So that would be, you would do the whole leg. Like when they're on their back, you're going to do all the leg. And then when they're on their, when they're face up, you're going to do the top of the leg. And then they can bend their leg for the knee as well, one at a time. So that is one little note about the upper leg. Let's talk about that. Sorry, I forgot to read this. Skin on the upper thighs tends to be loose, so extra care must be taken to keep the skin taut when removing fabric strips. Be cautious to never wax with one strip over the inner bone located at the top of the leg to avoid bruising when the strip is pulled. Always apply the wax in 2 sections in this area. So you're just taking your time, and you have to make sure that you can hold that skin tighter on the thighs, on the top of the leg, than the lower, the calf area and the back of the calf. Or the front of the leg, and the calf is in the back. So just whatever you're doing on your thigh, on the legs, be cautious to make sure that you're holding everything really tight. So you finish all of your hair removal. Your client, if she got all that done, is spent, and I'm sure ready to get the heck out of Dodge. So what you're going to want to do is give her some privacy, which you gave her privacy to disrobe, and you can take off your disposable gloves. And you're going to toss them, of course. And she's just getting dressed. And you will meet her when she's dressed. You will meet her at the client checkout area. Obviously, this is a time that you are going to go over maintenance and aftercare. Make sure that she's not exfoliating in the next few days anywhere that's been waxed. No sun exposure. I wonder if that's probably in the book here too, that I could give you even more things that they need to avoid after they get waxed. But it makes you super sensitive, so you need to make sure that you go over all of those things with your client. Okay, so after 24, 48 hours, it's okay to exfoliate, and you should probably encourage that so there's cell turnover. I don't want her just exfoliating the day of the waxing, but and tell them to do that on a regular basis. That way they don't get any ingrown hairs. Just so you know. The more often they come, the better it's going to be. So this is a great way to rebook, because then it can make the hair a little bit less coarse. Certainly underarms and bikini line, face, any of that. And then you can always recommend any kind of hydrating product that you feel like would be nice to keep the skin soft. Just looking and see if there's anything else in here that I would want to touch on to make sure. I think I've touched on everything that I want to. Yeah, I think so. So you'll get them checked out, and that's a really good reason to help them just continue to rebook right away. And once they are gone, you've got to get back to your room and clean up. That was a lot of waxing. So you're going to make sure that you discard any single-use items that were used that you haven't already. And if you used any implements, which you did, like your tweezers or scissors, you're going to place them in a closed container labeled to be disinfected. You've got to totally strip the bed of the sheets, the towels, blanket, whatever, and you're going to have it in a closed container until it's time to do the laundry. And then, and their cape and drape and all of that stuff. And then you're going to identify a proper cleaning agent. Read manufacturer's directions. Follow manufacturer's directions for mixing usage. You're going to wipe down your workstation and area with cleaning solution to remove debris. You'll identify disinfectant that is bactericidal, virucidal, fungicidal, EPA approved for use in a salon setting. You're going to follow manufacturer's directions for mixing and or using appropriate aerosol disinfectant. You're going to disinfect electrical equipment, store it in a clean area separate from other implements. You definitely had gloves on when you used that disinfectant, so you need to toss the new gloves that you had on, and then it's time to wash our hands. So we're going to go to the sink, wet our hands. You're going to get a coin-sized liquid hand soap, and you're going to wash your hands down to your wrists, and you're gonna wash the back of your hands down to your wrist. You're gonna wash your fingers, and you're gonna wash the backs of your fingers. You're gonna wash between your fingers. You're gonna wash between your fingers and your thumbs. You're gonna wash fingertips and nails. You're gonna wash thumbs, and you're gonna wash wrists. And you're gonna do all of that interlocking cleanse for a minimum of 20 to 30 seconds. Once you're clean, rinse thoroughly. Once you feel like you've had a nice proper rinse, you're going to get some disposable paper towels or a clean towel, turn the water off, dry your hands thoroughly. Paper towels can go in the trash. The dirty towel will go in with the other dirty laundry with that closed container. And then you're gonna find your 70% ethyl alcohol hand sanitizer, and you're gonna sanitize your hands. And then you will be perfectly ready to set up for your next client. So this concludes the video for waxing from brow, lip, underarm, bikini, leg.